Today's webinar is on fall prevention and improving your balance with physical therapist, Dr. Phil Finemore. And Phil is he'll explain more about what he does, but he's a mobile physical therapist. So he actually comes to your home, which is really great. I actually used Phil for back pain and hip pain, and he's very helpful in, of course, sharing exercises and working with you on honing in your mobility type, not mobility, what am I trying to say? The things that you do in your everyday life that are actually contributing to your pain. So you can kind of modify the things that you do and bend in the right way and all the correct mechanics. So anyways, he's going to be sharing how to improve your balance and try to prevent falls. We're also going to be having a webinar coming up on Tuesday, May 25th. We're going to have Evan Amel here that is going to be doing strength training for aging bodies. So that's going to be a really good one to also complement this webinar, I think. So I will have, and like I said earlier, we're going to be recording this so you can watch it later or share it with anyone that you think might benefit. And we'll get started. I'll leave it to you, Phil.
All right. Thank you very much, Kim, for all the kind words and the warm introduction. I would encourage everyone to check out Evan's talk too. I know Evan fairly well. He and I have worked together a little bit professionally. So Kim's exactly right. That'll accompany a lot of the things we go over today very well, because that's a very important part of our balance is our strength. So, and some key muscle groups. So that'll be a great talk. So I am Dr. Phil Finemore. I own WorkFitME Mobile Physical Therapy, where I help busy Maine professionals to maximize their physical performance so they can live a happy, healthy, and wealthy life doing what they love with who they love. I've really enjoyed being a fully mobile practitioner because, like Kim said, I can actually come into the environment that the person is living in and experiencing some of the things that that are interfering with their daily life, and we can figure out how to make those things doable without avoiding things due to what they have going on, and make sure that we're really attacking the situation from all angles to make sure that some of these very avoidable, preventable, and incredibly treatable things that people tend to deal with, such as like we're going to talk about today, falls or loss of balance, back pain, things like that, aren't a problem for them and holding them back from being able to get out there and be doing what they want to be doing, whether it's playing around with the kids or grandkids, or just being able to walk up their steps, or start enjoying some of this beautiful weather that we have coming our way here in the upcoming months. So, but today our focus is really going to be on improving your balance and falls prevention. Okay, so falls are one of, if not the leading cause of disability in older adults. It's all too common. I was actually just looking at something from the World Health Organization that was talking about musculoskeletal conditions, and similar to the stat I just shared with you about falls being the leading cause of disability in older adults, we almost say those statistics as like inevitable facts. Like it's just kind of the way it is. And so a big thing that we're going to cover in the workshop today is talking about how we don't have to accept everything that goes into falling as something that's inevitable. There are a lot of these things that we can curb and completely prevent in a lot of ways. There are some things that are out of our control with aging that can contribute to falls that we just can't do a whole lot about, but there is a lot of it that we can do a lot about. And if we take control of those things and get a handle on them, we can make sure that we don't become a part of that statistic of, as I got older, I wound up falling and severely hurting myself. Okay, so to start off, let's talk about the different sort of types of falls that can occur. There are things, again, that are out of our control. Especially here in Maine, the steps were icy, the walkway was icy, snow, whatever the case might be. Some external factors like that can cause a fall. Slipping or tripping over something. And here's a good little question to start, just to kind of kick us off with a little friendly competition, if you will. So if you're familiar and comfortable with using the chat feature here on Zoom, I want to know how many area rugs people have in their homes. Okay, so if you have some of those, type in the chat. If you don't worry about it. But that'd be something kind of interesting to know if you have area rugs. But things like that. 1, awesome. 3, okay. 3 is a popular answer. Okay, yeah. 1 is the winner of the friendly competition. Those can be a very common thing. An environmental factor. Okay, so my reason for bringing that up was there are environmental factors in and around our home that might contribute to us falling. And a lot of people say, well, if the walkway is covered in snow and I miss a step, or if the corner of my area rug is flipped up, and I trip on it, I can't control the snow, and maybe I should get rid of that area rug, but I like the way it looks on my living room floor, so I'm gonna so I'm gonna keep it there, which is all well and good, but sometimes even improving some things physically can help us prevent some of those external factors from resulting in as bad of a fall. Okay, and we'll get into that a little bit, but um, aside from the external factors, there are also some internal factors that can lead to falling. A big one in the older adult population is medications, right? So this is actually a great thing to bring up working with Coastal Pharmacy, because folks like that might be able to look at what you're taking for medications and give you a little information about where some fall characteristics could be coming from, and can work very closely with your primary care doctor to make sure that medications might not be contributing to your fall risk. Things like blood pressure can affect that. Heart rate or arrhythmias in our heart can affect that. Those are all intrinsic things. The biggest intrinsic factors within ourselves that we're going to focus on today are some of the main balance, our main balance centers, the things in our body that contribute most to our balance. Okay, so those things are our muscles, our strength in certain key areas, are in the basically from the core, kind of the waist down, mobility in certain key joints in the lower body, our nerves. So our nerves, two different kind of categories there: our ability to feel things, our sensation, whether we have numbness and tingling or not, and then our ability for our nervous system to tell our body where we are in space. Okay, which is also called proprioception. The next thing is our eyesight. Our eyes give a lot of information to our brain about our environment, that relays to certain areas of our brain and our balance centers to prepare us for movements that we have to make as we're walking. That's a big one that we'll talk about a little bit. And then the last one, the fifth one here, is our vestibular system. So that's the kind of the main balance center. It's a small system within our inner ear. If you yourself or someone you know have ever had vertigo, that is very commonly the vestibular system, or dysfunction in the vestibular system, is very commonly the culprit for vertigo. Certain types of vertigo are also very, very treatable. That's something that I work on and treat as well. That's another topic, but vertigo is something that can be treated very quickly without medication. We can actually fix the root cause of the problem as well. But that vestibular system working the right way and interacting with all of those other systems I mentioned is really how we keep our balance. And we can address that vestibular system even if vertigo isn't an issue, to make sure that we're looking at all aspects of balance. And we'll get into that a little bit. Okay. Before I keep going, as we go, please feel free to pop questions in the chat as we go. I will save time for question and answers at the end of the talk, but if something pops up, please feel free to ask as we go. So let's talk a little bit about how, real quickly, how some of these areas that we just mentioned, some of those 5 areas, change as we age. Okay, so when we talk about our joints and our muscles, those first two things we mentioned, we can actually reverse the aging process on our musculoskeletal system, our bones, joints, and muscles. It is true that it's harder to build muscle and that we start to get into our body actually absorbing a little bit more bone as we get older. That's especially true in females more than males. That's why osteoporosis is a very common thing that females have to deal with as they age. But those things can be preventable. Okay. Uh, Comparing that to like eyesight, there's really not a lot that we can do to change some of the sort of natural phenomenons that can happen in changing of our eyesight as we age. Okay, so we're not gonna go into that a lot. I'll give a tip to help you use your eyesight that you have a little bit better to help with your balance, but changing our sight we can't change a whole lot. All those other areas we've mentioned though, we can have a positive change on if we're targeting and working on them the right way. Okay, so yes, it's harder to build muscle. Yes, there are certain things that happen in our body that affect our bones and joints, like arthritis. Pretty much everybody gets it. However, arthritis on its own does not cause pain. It's usually due to imbalance around an arthritic area that puts more stress on it that causes pain. Again, that we could do a whole other workshop on that, but wanted to mention that really quickly. So those phenomenons that people kind of take for granted, like, well, I'm getting older, so I'm not as strong as I used to be. Maybe maybe I do have osteoporosis. Maybe I do have arthritis. It kind of is what it is. I can't do anything about. That's not entirely true. There's actually a real big push. Real quick example for knee replacements right now. A lot of and most of the surgeons in Southern Maine are really on board with this. A lot of those folks a lot of those surgeons are sending those folks to get what we call prehab, pre-rehabilitation before a surgery such as a knee replacement, because it's shown that even if you have to still have the knee replacement, if you're moving better in that joint and you're stronger in areas above, below, and right at that joint, your first at least 3 to 6 months after surgery are going to be better than if you don't get any rehab before a surgery that's that involved. Okay. And in my personal experience, I've had many people come to me specifically for that and say, you know what, I don't need to go have that knee replacement I was going to have in the next 3 to 6 months. Right. We're gonna push that out and keep working on this conservatively. Okay. So that's a phenomenon we're seeing more and more. And that just goes to show you that the physical therapy didn't take away anyone's arthritis, but we help the muscles and that joint be more supported, move better, and work better to keep that person moving without as much pain and discomfort, and get to a point where they say, you know what, I don't need to go under the knife right now. Okay, so all of that is to say we can have a really positive effect at any age on the health and how well our joints are feeling and how strong and stable we are around the muscles in our body, to keep those things going. Because if we're weaker or we don't move well in those areas, that can lead us to not being able to maybe catch ourselves when we fall, right? If muscles in and around our hips and things are weak, and certain areas in our lower body, like our ankles and knees and hips, don't move very well, when we do catch our toe on something, or we don't lift our foot high enough to go up the step, or we get our feet crossed in front of each other, it's going to be a lot harder for our legs to then move in the way that they need to move to catch ourselves before we wind up falling down, right? So that's why that working on the strength and mobility in the lower body can be really important in falls prevention, and working on certain key muscle groups in particular is really important as well. Okay. Since we did just mention it, as far as eyesight goes, and by the way, I'm going to show you a couple of exercises, a strengthening exercise, a balance exercise, and then we'll get into some of that vestibular system a little bit. I'll show you a quick one you can do to work on that and test yourself a little bit. So we'll go over those in just a little bit here. Real quick, while we're talking about eyesight, we can't really change some of the natural things that happen to our eyesight over time. Obviously, we can wear corrective lenses and things like that, but some of those things can get worse and worse, and things like macular degeneration can set in, and there's a whole other myriad of problems that we can't do a whole lot about except try to correct for it. The number one thing we can do to improve how our eyesight helps us in our balance is by actually not looking at our feet when we're moving around and looking up at the world around us. Okay. A lot of people look at their feet because they say, I'm scared that I am going to catch my toe on the corner, or the transition from my wood floor to my carpet, or the edge of the area rug that I have, or whatever the case might be. But by looking up, we significantly increase our field of vision. We have more peripheral vision. We're looking at the environment around us. And the more information our eyes can take in and give to our brain and those balance centers in our brain, the easier it's going to be to accommodate for those things. Okay. Because when we're looking down, it kind of lowers some of our peripheral vision, our field of view, and we don't see some of those potential obstacles coming. Okay. So for example, if you're walking down the street and you're looking down, and you don't see that up ahead of you, a ball of some sort is rolling out in front of you really quickly, and then you have to react quickly. And even if the ball doesn't hit you or interfere with your feet, your reaction to it last minute could, and you trying to avoid it last minute, could throw you off balance and contribute to a potential fall. Or like a curb. People worry about, oh, what if I have to step up onto something or step over something that's in my way? Well, if we're looking up, even just through our peripheral vision, we're going to be able to see those things coming. And then when we get to them, if we feel like we have to look down to step over it accurately, that's okay. But if your eyes are up and we know it's coming, we can be a little more prepared, and we're giving our body more information that it needs to keep ourselves upright. Okay. So that's my tip for helping with the eye situation is, let's use our eyes, let's look up, keep ourselves upright. It helps our body move and work better, and it gives our brain and our balance centers a little bit more information. Okay. The next thing we have is the nervous system that we talked about. Now, there are some changes that happen in the nervous system, like our reaction time slowing down and whatnot, that we can retrain to a certain extent, but some of those things are also a little bit inevitable, but we can improve upon them. If we have things like numbness and tingling or neuropathy, some people might be familiar with that, diabetic neuropathy, or whatever the cause of your neuropathy might be. When it gets to that point, we can't always have a very positive impact on the amount of numbness or tingling or discomfort that might be in the feet, for example. But what we can do is, again, retrain how those nerves tell us where our body is in space, and work on improving some of those pathways and improving how our nervous system out in our legs actually sends information back to our brain. Our brain then relays that information back to our muscles and tells us what we have to do to keep our balance. Okay. If any of you have had any sort of rehabilitation for falls, you probably spent a little time on some foam of some kind, or doing things with a very narrow stance, or one foot in front of the other, or even standing on one leg with your eyes open and eyes closed. All of that are examples of different ways we can challenge that nervous system. Okay. And in turn, we're also challenging your muscles and joints and things like that as well, because that nervous system has to talk to those areas to get them stronger. So again, it's something that we can't always fully prevent from happening. If we address it before it becomes a big problem, we can prevent some of those things I just talked about with the nervous system from getting to a point where we really can just help it, but can't fully take care of it. So that's why prevention is really important with falls, because we can, if we get ahead of the curve a little bit, we can certainly make sure that we're preventing those things. But it can be retrained. If you have neuropathy, it doesn't mean that you're a lost cause. If you have numbness and tingling somewhere, it could be related to something else that's treatable, and we can actually take that numbness and tingling away, depending on if you have something going on in your spine or something like that. But we can retrain different parts of that nervous system to make up for certain changes in the nervous system, so that is not a contributing factor to your falls either. Okay. Any questions as we go here? Anything specific popping up before we go over the last sort of tidbit, the last system that we want to talk about? Okay, great. So I also mentioned the vestibular system in the inner ear. Okay, so there are some natural changes that go on. Oh, we have one thing pop up here. Osteoporosis. Do you mean how does osteoporosis potentially affect your fall risk?
This is a previous question that I had when you were talking about osteoporosis, and I'm wondering, how maybe this is a question for the end, but that how do you gauge whether you've got it? Like if if you're taking calcium and you're working out and you're eating your green vegetables and everything like that,
Mhm.
how can you gauge whether you are getting osteoporosis, and what age does it typically start at?
Yeah, so the age range can vary a little bit depending on a lot of those factors you just mentioned, like diet, activity level. There's some genetics that are involved with that a little bit. Typically, we see it again. It's much more common in females. Typically, we see it somewhere uh, middle age, so probably or a little after that. So probably in their 50s or so, mid late 50s, it can tend to show up. The only way to know if you have it is by doing bone density scans. Um, so typically that's something that your doctor would do. They can also check levels in blood work for as you mentioned calcium, vitamin D, and all that stuff. And usually based on what they find in the lab work, that will potentially prompt a bone density scan. And then based on what they find in the bone density scan, they usually look at the pelvis, kind of just above the hip area, and somewhere in the spine, one or two spots in the spine with that bone density scan. Based on the values of the bone density scan, you'll be classified into osteopenia, which is like pre-osteoporosis, or full-blown osteoporosis. Osteopenia can be fully reversed with uh, treatment via supplementation, as well as some light to moderate impact exercise and strength training. Osteoporosis can turn into osteopenia, but when you go from osteoporosis to osteopenia, you're because of the process that's happening with the bone being absorbed, you're not going to wind up reversing completely out of that, but through light impact exercise and strength and stability training, osteoporosis can be reversed back to osteopenia as well. But to answer your original question, it is kind of based off your lab values of vitamin D, calcium, all that good stuff, and then doing a bone density scan to see where your levels are at, and to see if you have a lot of bone absorption going on in the
Great.
body.
Thank you so much.
Yes,
That's
you're
really
very
good to
welcome.
know.
Yeah, and that's why I did kind of bring that up, and why these things are so interrelated, because if we get key muscle groups stronger, some smaller stabilizing muscles through the hips, our glutes, or the buttock muscles, your quads, some stabilizing muscles around the ankles and things, and those things are not only going to help folks prevent some of that bone absorption from going on and leading to osteopenia, osteoporosis, but we're going to be moving better. We're going to be moving in a way that's going to keep our body more stable and on our feet, and we're going to be less likely to suffer from falling by not being strong enough to control and move our body in certain situations that could lead to a fall. Okay.
Hey,
So
Phil,
yes,
I was gonna, and you know that I'm talking about my father.
yeah.
Is for people that are pretty advanced with their health is really pretty far gone, and
Mhm.
they sit a lot and they don't have a lot of mobility. it- how is there anything that they can do, that like maybe chair exercises even, or something that would help them?
Yeah, no, definitely. There's never a point where it's too late to start working on your strength and your mobility. The starting point for everybody is going to be a little different, because in order to really build true strength, it takes consistency over time, and we've got to kind of lay a foundation and get muscles working the way we want them to first, and then we can progress and actually move into, okay, now we're actually pushing strength, which again, takes some time to get to that point, and then takes more consistency to get where we want to be. But yes, there are some things we can do. Actually, the one exercise that I will show everybody here is going to be from a chair. The first thing I'm gonna show everybody. But yeah, even just getting sometimes doing something as simple as during your day, whether you're sitting and reading something or watching something, or you're driving in the car, wherever the case might be. A good quick one is just squeezing your buttock muscles, kind of squeezing and clenching your buttock muscles to get those activated, because those are a real important muscle group that we need to, number one, get activating and working better, because they're muscles that tend not to, we compensate for them pretty easily during our day, even though they're a big muscle that do a lot for us. But just squeezing the buttock muscles and then relaxing, holding about 5 seconds, relaxing. You can do that as much as you'd want to. And I'll show you another exercise here shortly to advance that. But yeah, sitting, squeezing the buttock muscles, sitting and picking your knees up as high as you can without moving your upper body too much while you do it. That'll help you work on clearing your feet a little bit. I've actually got another exercise I'll show everybody that's kind of an advancement from that too. But yeah, depending on the situation and depending on where you're weak, where you need mobility, there's a starting point for everybody, and you can improve upon that no matter where your starting point is. We just got to be working on it the right way and at the right level for you as an individual. Yeah, awesome. So with the vestibular system, I want to go over that real quick, because this is one of the biggest things. Just a couple of years ago, I got a certification for vestibular rehab. So I'm a vestibular rehab specialist. I talk a little bit about treating vertigo, BPPV, if any of you have heard of that or had it or suffer from it. That is very treatable. And as physical therapists, we learn how to do that in school, but there's specialty training you can do to kind of advance that. But with that, we also learned a lot about how in balance training, traditional balance training with physical therapy, like I mentioned before, maybe you stood on some foam, maybe you stood on one leg, maybe you put one foot in front of the other. We're still missing a big piece of the puzzle, and that is our vestibular system, because that system kind of passively, not kind of, it passively tells our brain and our body the direction that we're moving in, so that we can kind of almost prepare ourselves to be able to do other tasks while we're moving. Okay. So a good example of how we use that vestibular system, if you've ever been driving down the road and you need to be able to read an exit sign to know where your exit is on the interstate, or a sign to turn into the store that you're turning into, our body's ability to be moving, know that we're moving, and look at and read something that's on a sign is our vestibular system, right? So we don't have to think about the fact that we're moving in this direction at this speed, right? It's true for walking too. It's why we can walk and read at the same time. Some of us can't, but it's why we have the ability to do things like that. So when we turn our head side to side and we can still focus on something, there's some reflexes in our brain and our nervous system between that vestibular system in the inner ear and our eyes, and then to the brain itself, that allow us to make those movements and still focus ourselves if we need to. Okay, so it's very important balance. It's telling us about, it helps us tell us where our body is in space and how we're moving and how quickly we're moving and things like that, so that we can still be kind of doing other things while we're moving, and all of our focus isn't on, I have to be moving like this and at this speed, right? And the canals in that vestibular system have fluid in them, and sometimes that fluid can fluctuate up and down as we get a little older. Another thing that can happen, going back to that osteoporosis, is there are little small kind of bony crystals in that system that help tell our body that all that information I just mentioned, and those can get dislodged. That's what can cause vertigo, but changes in those areas can happen as we age, which we can't do a whole lot about. So because of that, our bodies get really good at compensating for that vestibular system not working as well as we want it to. So we can kind of dull it down, and we can compensate for it by, if we get dizzy when we move our head, we're able to stare at one spot and let it calm down, or we avoid doing quick turns and things like that to compensate for it. So if we're training our nervous system, our strength, things like that, but we're not doing some training for that vestibular system, we're only going to get so much improvement. And I am totally guilty of this because, again, this is a part of this specialty training. They don't go over it this in depth in our schooling. They teach us more about what the vestibular system is, how to treat some vertigo, and we move on. But incorporating it into balance has proven to be pretty significant, because there are people I've worked with who avoid like turning their head when they're walking, right, to see something, or when they do, it throws them all off, right? And that's not because they made a quick movement and they couldn't stay stable. That's actually probably because there's something going on in that vestibular system where it's regulated down a little bit, and we need to ramp it up a little bit to make sure that if they're walking and someone says their name out of the blue, they can, turn and look and not worry about falling over, or even just the ability to be walking, stop and turn around or change direction quickly. That doesn't just have to do with our ability to move and be strong and stable in our legs, or for our nervous system to tell us what we're doing. That has to do with that vestibular system. So again, very common things in balance rehab are to put one foot in front of the other, stand on one leg, stand on foam, eyes open, eyes closed. But if we're not doing some things that actually challenge the vestibular system, we're only going to see so much improvement. And that vestibular system might be a huge part of why you're losing your balance, and we can retrain it. Okay, so that's the moral of the story. Is pretty much everything here that we've talked about today, except for major changes in our eyesight due to conditions that we really don't have a ton of control over, except for giving us corrective lenses. We can change, we can improve, and we can really, really make sure that the things that are going on in your own body that we can have an impact on at any age aren't the reason for your fall, right? We can't control Mother Nature in that there was some ice and then some snow fell on top of it and you didn't see it and you fell down. What we can do is make sure your body's more prepared to handle situations that you can't control, and make sure that your body is not the reason that you're falling down. Okay. So any questions on any of that? Any more questions that have popped up similar to those last couple that we answered before we start going over a couple exercises you can do to improve these things? Okay, great. So I'm going to share my screen real quick. The first thing I'm going to show you is a sit to stand exercise. So it's a good way to get some of the major muscle groups in the legs working, that are very important to stay strong and moving the right way, to help us keep our balance. So I'm going to share my screen real quick. Okay. So here we go. You're going to sit in the chair, sitting nice and upright. You can see when I lean forward here, I'm doing that from my hips, right? So I'm not, yeah. So I just tapped my shoulders. Keep nice and tall there. Lean forward at the hips. You can use your hands on your thighs if you need to, but by keeping your chest tall as you lean forward, getting your head and your nose out over your toes. And then the big thing here is, whether you're using your hands on your thighs or not, think about squeezing your buttock muscles as you come up off the chair. Okay, so your buttock muscles, your glutes, and your quads, or the front of your thigh, are the primary muscle groups that should be getting you up out of the chair. Okay, when you're doing that motion. So what I usually tell people is to do about 10 of those in a row. You can do 3 sets of 10 at one time, or you can spread it out throughout the day. Do 10 of them three different times. Doing it repetitively like that just gets those muscles working in a way we want them to work when we're moving around and doing daily things like getting up out of a chair, going upstairs, even just walking. Those muscles are working the right way. But by doing 3 sets of 10 with a little short, 30-second break in between sets, can stress those muscles at one time a little more than our general daily activities do, and actually start working on some proper muscle activation and working into a little bit of strengthening, depending on where you're starting out from. Okay. There are some different ways you can modify that. You can do it in a chair with arms and use your arms if you feel like you need to, and please do that if you feel unsteady when you do it. Like I said, you can do it with no hands. You can do it by pushing off your thighs. But the big thing is keeping your chest up tall as you lean forward, and squeeze those glutes, squeeze the buttock muscles as you stand up. Okay. Any questions on on that one before we move on? Okay, fantastic. Let me show you another one here. This is going to be a marching exercise. So you can do this sitting, like I had just described earlier with Kim's question, which is if you're just sitting upright in a chair, just alternate lifting your knees up as high as you can without leaning back or doing too much with your upper body. It should just be with the legs. You can just alternate sides. That's similar. But what I'm going to show you is in a standing position, just to actually challenge some different areas of our balance a little bit while we're doing it. Okay. So let me pull that up. I'll play this for you. So I'm holding on to a chair here that won't move. I really like to have people do this at their kitchen sink at home. Okay. Because that kitchen sink's not going anywhere. Right. And the lip of the kitchen sink is something that you can actually wrap your hands around. Right. And grab onto. So what I did there partway through was moved my hands. So I'm using a little bit more of my arms to support myself right now. But partway through here, you'll see me just kind of hold on with my fingertips. And what that's going to do is make me rely more on my legs to keep me upright while I'm doing this. So you want to be nice, slow, and controlled to this. Trying to get your knees up as high as you can with each rep. Try to put your foot back down in the same spot it was in when it came up. So a lot of people wind up moving to one side or another, or they start with their feet about hip width apart and then they're almost touching each other as they're going through. You want to try to lift your foot up and put it right back down where it started. Okay. This one you can do so right leg, left leg is one. Do about 10 to 15, do 2 to 3 rounds of that during the day, just to work on being in a single leg position, and we're working on just being able to pick your legs up. Okay, that's a great one. If you feel unsafe with that, don't use your fingertips, hold on. If you even feel unsafe with that, start sitting just to get some of those muscles working, and then you can kind of work your way up a little bit. But if you feel so unsteady doing that one in that standing position, actually gripping on to something that's not going to move, if you're feeling unsteady and uncomfortable with that, we should probably do some work to get you to a point where you can do that, because that tells us that there's definitely some balance issues going on that should be addressed to avoid some falls. Questions on the marching exercise? Okay, fantastic. And the last one I'm going to show you is something a little different, but it's a way to work on and sort of test a little bit in the safest way possible if that vestibular system is part of your particular balance concerns or something that you can be working on. So this is kind of the lowest, these couple things I show you in this video are kind of the lowest level of that. So for some of you might say, nah, it didn't affect me any, but there's some progressions that we kind of have to take you through to see how much it plays a factor in your balance situation. But this is just a good place to start. So I'm going to show you that. Oops, I got to start it over here. So you can see in this video here, I've got 4 sticky notes that I put in a diamond pattern on the wall, and they each have words written on them. Okay. So we'll start playing this here. And what you're going to do to start with is, you can see I'm going up and down. And every time I lift my head and eyes up, I'm focusing my eyes on the home and ball. Okay. And I'm actually, you can see my mouth moving in the video. I'm actually reading them as I do that. So my whole head and my eyes are moving together, but I'm having to focus my eyes on the word home and then the word ball, back and forth, back and forth, back and forth. And then what I do here is start going side to side, doing the same thing. Okay. So up and down, side to side, that's going to challenge multiple areas of that vestibular system. The next thing you're going to do is focus on one of those sticky notes, keep your eyes focused on it while turning your head back and forth. That's kind of the next level. And then you can do the same thing, moving your head up and down. So you see, I focused on one of those. You can see I focused on one of those, and those last two, one of those sticky notes, kept my eyes on it, went up and down. Okay. Found another one and then went side to side, doing a pretty good, and the amount of motion I'm doing right now is how much I was doing in that video. And you're keeping your eyes fixed on that the whole time. Again, that's going to work that vestibular system. So if you do that and you're getting a little almost discombobulated, a little dizzy, that's something you can work on. If you do it and do get a little dizzy, you want to, don't keep pushing through it. You want to stop and just hold your gaze on one of those sticky notes, let it calm down, and then try it, and then try it again. Okay. So you want to do those, each of those 4 movements right there. Try to do them for like a minute at a time. Get to a point where you can do each of them in a minute in a row without feeling, maybe dizzy or discombobulated. And please do these sitting. Okay. I was sitting in that video. Don't do these standing up without being evaluated, because that's potentially dangerous. We don't want anybody falling while trying to do the fall prevention exercises. So, but yeah, give that a try. And that's, again, it's a part of balance training that I've integrated a lot more with people that I'm seeing for balance. And it's a noticeable difference. There are some people that can do the stand on one foot in front of the other stuff pretty well. They might have a few wobbles here or there, but it's not incredibly challenging. We throw this vestibular stuff at them with some of those things, and it's an absolute game changer. And it's something that progresses their fall recovery and their fall prevention strategy further, a lot faster and a lot more effective. It's a lot more effective. So questions on that at all, or other questions in general? See, I do balance exercise on one foot and the other, so across, closing eyes and balancing. Any suggestions to stop thinking about it with the expectation that I will fall? That's a hard one. That's a very hard one, Deborah. The fear of falling, actually, I didn't mention this. I'm really glad you brought this up. Fear of falling is probably the number one reason people fall, right? And that's kind of exactly what you're describing there. Some of that is confidence. What it sounds like is, what it sounds to me is, like anything, if we do especially with our body and our physical abilities, strength, balance, things like that, if we do the exact same thing over and over again, eventually we get so used to that our body's good at it, and it's not necessarily challenging enough for us anymore. Okay. And I don't know if you do other things like some actual leg strengthening or anything like that, but incorporating some strength training along with that might make you more confident, because it'll help you move a little more effectively. Because most of the time, and here's the other thing, we have to be doing, with balance training, we have to be doing some dynamic things too, right? Like actually moving while we're challenging our balance. That's why the vestibular stuff's important, and some other progressions we can do are important, because most of the time, we don't fall when we're standing in one place, or even just standing on one foot, right? Especially if we train into that. It's when we're moving, trying to lift our foot to go up another step, stepping to the side to grab something further over here off the counter, and our foot catches because we don't move it as well as we should, and we're trying to lean and reach outside of our base of support. So it sounds like in your particular situation, it really, there might be some progressions or some other things that you need to work on, for sure. But it sounds like some of your balance exercises need to be progressed a little bit too, and that's something that can definitely be looked at, for sure. Awesome, great question. Any other questions? I just got one more little thing I want to touch on before we fully wrap up. But if anyone else has questions, I'd be more than happy to answer them. I definitely want to thank everybody for taking the time to join us this afternoon for this. I always love to make sure I give a good thank you to everybody who does take the time to join one of my workshops. A part of what I do is fall prevention screenings, where we can actually look at what you're currently working on. Well, thank you very much, Deborah. I really appreciate that. So we can take a look at in the screening what you're currently working on, where all those areas at, right? We look at the vestibular system, your strength, your nervous system, all that stuff, where you're at, where do you want to be, and how are we going to best prevent falls for you? And we can develop a game plan on how to do that most effectively for you. So I do have some fall prevention screening spots that I saved on my schedule for next week. I've got 2 that is able to scoot in for next week. Normally those are at $180 for a hour plus long screening, but for anyone in this workshop, I'm going to offer those 2 spots at $80. So I've got 2 spots. So if anyone would like to take advantage of that, please let me know in the chat, or you can reach out to Cam or myself directly, and we can get you hooked up with that. But would like to offer that to anyone who's looking to make sure all of those areas are taken care of for them, and we're avoiding things like fear of falling, and make sure we're doing all the things we can be doing to prevent you from falling and hurting yourself potentially. So yeah, just let me know either in the chat or send me a message, and we can get that set up for you.
Thank you very much, Phil, for doing this presentation. It's very valuable. And we have so many people that come into the pharmacy that are in pain. And I think these webinars that you're doing on strength training, and basically it all kind of revolves around pain. And people you don't want to get to that point where you need to have a medication or something else. So I really appreciate you sharing your knowledge, and we'd obviously love to have you back for other topics. If anyone does have a suggestion on a topic that we'd like Phil to cover, just send me an email or send Phil an email, and we'll get it scheduled.
Yes, and I'll actually put my my email in the chat right now. If people would like to get a hold of me, I'll put my my phone number there as well. Those are the 2 best ways to reach me. So if you want to take a little screenshot of that or anything, you can. Yeah, happy to help in any way and answer any questions after the workshop as well. And would love to come back and share some more information for everybody, of course.
Thank you, everybody, so much for attending. This is great that we have so many people that are interested in furthering their health. So
yeah, definitely.
Have a great day.
You too. Thank you.
Bye.